Hospital welcome you all to this press meeting. Uh, in my capacity as Director, Emergency and Trauma Services at Artemis Hospital, I welcome you all to this unveiling of a landmark technology which will leapfrog us as far as emergency services concerned into the next generation. We have officially launched the 5G enabled ambulance services in Artemis Hospital today. It is definitely the future of emergency medicine because how it matters. Emergency, as you all know, is care that is time bound. Emergency care means time is muscle, time is brain, and time is life. So the earlier we can reach to the patient within the so-called golden hour, the better for the patient. Okay. So how does this launch of this 5G ambulance services makes a difference? It gives us a real-time audio-visual transmission of the patient right from the time the ambulance picks up the patient. The patient data is transmitted to the emergency doctors who are sitting in Artemis Hospital emergency room. The paramedics can relate all the patient condition to the doctors. The doctors can advise accordingly what treatment needs to be done to the patient. Supposing a patient is reporting with chest pain and calls for the ambulance. So the ambulance, within a matter of no time, picks up the patient. The real-time ECG of the patient is transmitted to the doctor sitting in the emergency, who then connect with the cardiologist, and the treatment that is usually started in the emergency room can now be started in the ambulance itself. It is now akin to an emergency room being carried to the patient at their doorstep instead of the patient coming to the emergency and seeking care. So this is critical care which is being given to the patient right at the doorstep of the patient. So this is the future of emergency medicine. The pre-hospital medicine is advancing by leaps and bounds the worldwide, and we are taking a cue from that. And now, with the establishment of this 5G ambulance services, we are at par with any good emergency services anywhere in the globe.
Question.
Yeah.
So when you're talking about 5G, congratulations to the Artemis team. And you said it's in critical care. So for the patient, say, a patient who's like say suffer from an heart attack.
Yeah.
Right? So he calls for your hospital, you send an ambulance.
Yeah.
So then how do you bill it? Essentially, does it carry any cost to this?
See, what is the normal that we are charging for the patient for the ambulance services, that is being levied to the patient. Okay.
No extra cost.
No extra cost.
It's
It's an improvement in quality, not an improvement in cost. I think that's an understanding that we also have with Artemis hospitals and overall that this is being done to improve the overall accessibility and effectiveness of an emergency service. It's not a upsell to the customer at all. We provide the services at the same standard. On the contrary, we want to make 5G ambulance the gold standard of emergency response services.
Okay. And another thing is, like you said, it's audio-visual, right?
Yeah.
Audio-visual, so when the ambulance reaches a patient doorstep,
Yeah.
is there anybody shooting? Is there anybody shooting the patient, what condition he is in?
It is not the
How is
patient.
it monitored?
It is.
So these are IoT devices where your parameters are directly related on a screen. So once the ECG leads are put in, the BP cuff is put
Once
in.
the stretcher boarded in the ambulance, hooked onto the monitors, then it starts transmitting.
What service is 5G? Who is the service provider for 5G? Who is your service provider for 5G?
5G.
So you're asking about the telecom providers. Telecom providers can range. We can use Jio, Airtel, anyone for that matter, from a telecom point of view. But the idea of using 5G is because obviously of the low latency that it brings in, and That's the reason for using 5G, because it allows for faster communication, telemedicine, data transmission, and that's why we're using 5G over any other.
And it's a seamless transmission of data across various providers actually, irrespective of whether it is Airtel, Jio, whatever it is. It is a seamless transmission of data.
We would just like to, I would just like to add to it. So any one of you can dial this number written on the screen from your phone and just put it on the loudspeaker. I'll do it for you. So 0124 4588 888. I'm just putting this on loudspeaker and let's see what the response is. One minute.
Good afternoon. My name is Dave. I'm speaking from Artemis Ambulance Services. How may I help you?
That's what we are assuring. So thank you. That was a test call. Sorry. So that's what we are assuring, that once someone is trying to reach out, it's a seamless access. Calls will be answered within 3 minutes. So that's an assurance. Ambulance will leave my hospital premises in next 3 minutes. That's the second assurance we bring along. And third is, once you are boarded into the ambulance, 30 seconds you are connected to my doctors. So that's the power of 3 what we are trying to build in. We are also assuring that ambulance right now is not a mode of transport, but it is a treatment modality in itself. So your treatment will not be started once you are landing at the hospital, but when you are picked up at the venue, right? So that's where the treatment starts. So that's what we are bringing in, and as Dr. Shubhashish mentioned, that golden hour. So transport can take anything from 5 minutes to any number of hours. We can't predict. So that transition time is generally lost in managing the patient, not in treating the patient. With the launch of 5G, we are starting the treatment. That transit time is the treatment time, actual treatment time, where there is a VC. If required, my cardiologist can come and join that VC and direct the doctor on call or the nurse that this needs to be started, this medicine needs to be started. Whatever extreme possible we can do, we will be doing that. So that's the endeavor of the 5G.
See, by launching these services, what Dr. Vishal is saying, we are redefining the golden hour now.
Yeah.
We are, in fact, it is a mobile emergency room that is reaching the patient's doorstep. So the so-called golden hour is not wasted in transporting the patient. It is utilized to treat the patient, basically. That is the difference.
And the idea is, I think, we want to ensure that ambulances become points of care rather than just transport vehicles. They should be able to provide services of mobile ICUs, and especially with getting the doctor's brain on the field, where with two-way communication, the patient can be treated while in transit, and the hospital will be more prepared about the incoming patient.
Are there any government or regulatory bodies involved in approving or supporting this initiative?
Right now we are starting on our own, basically. In fact, we have got no holds bar. We can pick up patients from anywhere across Delhi NCR and even outside, So we are open to our ambulance services everywhere across, basically.
So I would like to say that Medulence as a company had envisioned a 5G smart ambulance. I would say a few years back we launched it at the India Mobile Congress, this concept of a 5G ambulance, and it was launched by the Prime Minister himself. Today, with the support of Artemis Hospital, we are able to bring that vision to life, I would say, and now we see real case scenarios of the 5G ambulance that are being used on the field.
So Medulence is a separate entity, is it?
Yes, sir. So we are an ambulance company. We provide emergency response services. The idea is that this is a combination of a healthcare institution and an emergency response company coming together to provide higher level care to the patient. And with the vision and leadership of Artemis Hospitals, we've been able to, as I said, implement the 5G solution now, and we'll probably take it to scale not only within Gurugram but also to bring in patients from remote areas in Haryana who don't have a close by smart hospital and get them to Artemis while the patient is being monitored real time while in transit.
And if we may know, what's the kind of a cost for the ambulance?
So I would say that an overall cost from a capex point of view of a 5G ambulance would be about 40-45 lakh rupees, and can go up to about 50-60 lakhs depending on the kind of equipment that you put in the ambulance. However, this is a cost as it's not being transferred to the patient. Medulence and Artemis hospitals are absorbing this cost to ensure that the patient gets the benefit of the solution and not transferring the cost of the solution.
And what does a well-contained ambulance contain? What all monitoring systems are there?
So this would be a 5G smart advanced life support ambulance, which is just like an ICU on wheels. So
It's a
it has
mobile
all the
ICU.
facilities of the ICU, and right from a ventilator, defibrillator, a monitor, and also two-way communication between. As I said, it has a TV set up inside the ambulance so that the doctor inside the emergency room can speak to the paramedic while the patient is in transit. Their vitals can go to sir's emergency room while his team is monitoring the patient, and it's a complete ICU setup on wheels.
So at present, Artemis is with how many of these 5G ambulances? Like we saw two.
3.
The third one wasn't that being labeled.
So that is to, the branding has to be changed, but yeah, I'll give you one more stat for you here. So the price point at what we have launched, it is the lowest across the hospitals in Gurugram. So I don't see any competition, I'll not name it, having a 5G fleet. We will be the 5G fleet with the lowest cost to the patient in Gurugram. So your first question was pertaining to any additional cost. We have brought down our cost while we go 5G. Because this is something what we feel this is because of ambulance non-availability and the tags of ambulances, there are a lot of deaths which are happening, so we want to save lives, and that's where this initiative comes in.
Just another question which comes in mind is like when we are on the roads. So suppose I am aware that an ambulance is behind me, so I am trying to give it way. But normally in part of Delhi NCR, the citizens are not so aware and they are just even the cab drivers. So are you working with the police people that will assist you there?
So maybe
A lot of time is lost
Yeah.
there.
yes,
So see, a lot of hospitals are coming up with initiatives. I would say even a company like Medilins, and we would do something with Artemis hospitals as well to ensure that we send the message about people giving way to the ambulance. I think the situation has improved. The government now imposes a fine as well for people blocking an ambulance while a patient is inside the ambulance in transit. And I would say we'll do more on spreading this awareness. I think with the advent of spreading information about the existence of ambulances that could save your lives, I think more is going to happen on those lines.
You need a separate corridor.
So creating a separate exclusive corridor
No,
in the
no,
traffic
no.
is here. But yeah,
At that point of time, when people take a left or a right, and it's made that the ambulance will go.
that awareness government is running, as Pranav said, now there have been penalty which has been started if you are not, as a driver not giving side to an ambulance, it is being charged as a penalty. Right? So the challans are being issued. And that is something that has to come from within oneself, and eventually, yeah.
Sir, and being
Things are
talking about a
changing.
corridor, I would say that's the ultimate dream for a company like mine also. They'll allow us to do our job better. Even for Sir's team will allow them to do their job better. The patient can reach faster. Helps improve a lot of steps. So that's something I would say. If it happens, we'll keep vouching for it. Firstly, the idea is to spread awareness that people give way, and then look at that.
So again, the advantage of having a 5G system is that even if there is a delay on the way, the EMT, the paramedics is in direct touch with the doctors. He is constantly advising the treatment and all. So there is no gap, there is in the continuity of care of the patient. Again, this is where the 5G technology helps.
There's an article last week that organ transplant, so that thing the police is taking
That's a green corridor.
distance in the time which is cut down.
Any organ transplant, a green corridor is created, which is a seamless access. A pilot vehicle will run along with it. That's a seamless access from the point of pickup to the point of drop.
Yes.
So I already answered this. So power of 3, right? So within 3 bells, my phone will be answered. 3 minutes, my ambulance will be out of the doorstep. Try any hospital. I am telling you, try any hospital in Delhi NCR if you get a call answered in 3 bells. That's an assurance. That's the service excellence you are bringing in. In 30 seconds, you are onboarded. Your treatment is started. So one more value add. So as a service provider, only a doctor can accompany. But once we are getting your vitals and we want that a neurologist should come in and see you and give directions accordingly. So it is not because the war room is set inside the hospital. We can just call up the neurologist team. Please come. There is a patient in transit who needs your opinion, and your expert advice should start on the move. So that's the differentiator what we are bringing in, which my competition for sure will. ये पूरे इंडिया के लिए शो है, कहीं पे भी हम लोग ये कर सकते हैं. So this is not restricted to any place. We are open for providing ambulance across the country.
In fact,
ड्रॉप तो कहीं भी जा सकता है. पिकअप will depend upon हमारा नेटवर्क वहाँ पे कितना स्ट्रॉन्ग है, बट ड्रॉप पूरे इंडिया के लिए we can cater it anywhere.
In fact, coming to your question, to add to what Dr. Vishal says, the advantage is we are not wasting time in the emergency room. After the patient comes, we spend some time taking the history, doing the relevant investigations. In situations like a 5G enabled ambulance services, probably things would already have been done en route. So supposing a patient has been transferred with a heart attack, the emergency doctor in my team will already alert the cardiologist. He will be seeing the ECG himself. If required, he will be activating the cardiac cath lab. So in situations like this, patients will be straight away wheeled from the ambulance into the cardiac cath lab. You can see how much of time is saved by this 5G technology. That is what we are aiming to do. That is the future.
And also I would say that over a period of time, as you pointed out, there are hospitals that are doing this, but the idea would be, I think, with Artemis hospitals, Medellins, combined would want to publish emergency response reports regularly. That would also have success stories of what the 5G solution did, I think. And since all of that data is being recorded, and being looked at by a doctor real time, we'll be able to also say what were the outcomes that came out and how many people got saved because the solution was in live. And I think that's what is critical as well.
Thank you.
Thank you. Thank you. Thank you.
Thank you for taking. Yeah, please.
Operational infrastructure needed at Artemis to accommodate this ambulance.
Yes, of course. So we have created 2 rooms. One is the dedicated help desk where these calls will be answered. There are people only to answer this line, right? And second is the video conferencing room where this technology, the relay can happen between the ambulance and the hospital. So that's the other hardware which is being created. So there are 2 rooms which has been created. Thank you for taking out time.
Thank you very much.
Join us for the lunch. Thank you.
Small bite.